Today, we're diving deep into microneedling, also known as skin needling, a powerful skin treatment that can address a variety of skin concerns. Whether you're curious about how it works, the difference between Dermapen and dermal rolling, or the ideal treatment frequency, we've got you covered, and we believe it is one of the best treatments to get done for your skin concerns. So what is microneedling? Microneedling involves creating tiny, controlled micro-injuries in the skin using fine needles. This stimulates your skin's natural healing process, leading to increased collagen and elastin production, which are essential for youthful, glowing skin. But not all microneedling devices are created equal. First, let's talk about dermal rollers. These contain hundreds of needles on a round steel drum that rolls over the skin at a diagonal angle. While effective, this method creates triangular wounds, which can cause more trauma to the epidermal layers, leading to longer downtime and a higher risk of post-inflammatory hyperpigmentation. Because of the pressure applied, thicker needles are needed to avoid bending or snapping, resulting in more bleeding and the need for anesthetic, which can extend treatment time and limit who can undergo the procedure. Now compare that to Dermapen, which uses vertical needling technology and is how most professionals perform microneedling on clients in clinic these days. This method creates vertical microscopic channels in the skin, significantly reducing the risk of trauma. With no risk of needle bending or snapping, Dermapen uses finer needles and eliminates the need for anesthetic, allowing for a quicker, more comfortable treatment with less downtime. The pen also features an adjustable needle head and multiple speed settings, enabling customized treatments for each client's unique skin concerns. Microneedling can target different skin layers depending on your skin concern. When we work within the epidermal layers, we trigger an inflammatory response characterized by erythema or redness without blood. This response stimulates growth factors that speed up cell turnover, brighten the skin, and boost circulation, which helps detoxify the skin and kill bacteria. On the other hand, when we reach the dermal layer, we trigger the wound healing response, which involves both erythema and light blood spotting. This deeper response releases growth factors that encourage fibroblasts to produce more collagen and elastin, strengthening capillary walls and promoting the formation of new capillaries. Here's where each skin concern lies. In the epidermal layer, we treat pigmentation, breakouts, post-inflammatory scarring, dehydration, congestion, and oily or dry skin. In the dermal layer, we treat fine lines and wrinkles, rosacea, broken capillaries, stretch marks, open pores, redness, pitted scarring, and overall rejuvenation. However, not everyone is a candidate for microneedling. Avoid this treatment if you're using Roaccutane or Accutane, have recently undergone chemical peels, laser treatments, or have certain medical conditions without a doctor's clearance. Always consult with a professional before starting treatment. Microneedling treatment frequency depends on your skin's needs and age. For an inflammatory response, treatments are generally spaced 2 to 4 weeks apart, while for a wound healing response, sessions are scheduled 6 to 8 weeks apart. Typically, you'll need 6 to 8 sessions for each concern to achieve optimal results. Frequency and the amount of sessions will vary client to client and will be decided by the skin professional. Now let's take a look at what a professional Dermapen procedure involves. First, a double cleanse will be performed to the skin. A sterile environment with the necessary tools will be prepared. Next, they should be disinfecting the skin next. A serum is generally applied as they work. They perform passes over the skin with the device to ensure thorough coverage, adjusting the needle depth as required. After the treatment, the skin gets wiped with a solution. Sometimes they may apply a hydrating sheet mask, and then they will finish with post-care products and a physical sunscreen. Post-treatment care is crucial for maximizing results and minimizing risks. Use a physical zinc-based sunscreen daily and follow your skin professional's advice. Avoid harsh environments, hot showers, and touching the skin for at least 24 to 48 hours. Wait at least 3 to 5 days before using exfoliants or retinol. For those of you looking to enhance your skincare routine at home, we strongly recommend using only a 0.25mm dermal roller. This size is perfect for creating microchannels in the skin, allowing your active serums to penetrate more deeply and work more effectively. But remember, this is for mild skin rejuvenation and to boost product absorption, not for deeper skin treatments. Here's how to use it safely at home. Always cleanse your skin thoroughly. Use the dermal roller no more than 2 to 3 times a week, as overuse can lead to irritation and over-exfoliation. After rolling, apply your favorite serum immediately to take advantage of the enhanced absorption. Follow up with a moisturizer, and if you're rolling during the day, always apply sunscreen. Be cautious around delicate areas like the under eye region where the skin is thinner. Remember, do not use larger needle sizes at home. It is becoming easier for people to buy skincare devices online, but microneedling should be left to the professionals in a sterile environment. When done at home, it increases the risk for infections and skin damage. Microneedling is a versatile and powerful treatment that can transform your skin when done correctly. Whether you're dealing with acne, pigmentation, wrinkles, or scarring, microneedling can be a great treatment to help. If you want to learn more about professional skin treatments for hyperpigmentation, check out this video here next.